All right, folks, it's just about 7 o'clock. Um, I like to try to start these sessions on time. I try to be respectful of everybody's time. Great to see you. My name is Joel Lowsky. I'm the Director of Academic and Industry Relations with Aspen Dental Management. I'm very happy that we are continuing our Ask Me Anything series tonight. And tonight we're featuring three clinicians, Ohio-based. It's nice to have a little bit of geographic centrality, so we should see some Ohio themes amongst our participants tonight. Tonight we've got with us Dr. Schooley, Jessica Johnson, and Kristen Sukop. She's got a double last name, but I don't want to butcher it, so I just went with half. So folks, you might see at the bottom of your screens, there's a Q&A option. You can use that to pose any questions that you might have, and I'll field those questions and present them to our panelists. You also, in your email that you received after registering, you got a link to a Google form, and I could see that a bunch of folks have used that to ask questions. So I'm the moderator of these events, which means I get the privilege of asking your questions on your behalf to our panelists. I'm sort of mission control here, and you're going to see me going back and forth between my monitors because I've got your questions up on two different screens. So I know you're here to hear the clinicians and not me. So moving right along, I'm going to ask our clinicians to give a brief introduction, and then we'll dive right into your questions. I see the list of questions is already growing, so that's great. So Dr. Schooley, why don't we start with you? Go ahead.
So I'm Dr. Schooley, Jimmy. I'm Managing Clinical Director in Columbus, Ohio. I've been practicing for a couple of years now, or this is my second year, graduated last May from Ohio State University. And he told me to make a fun fact. I usually say I'm in a movie, sounds really cool. And then I say I was an extra in a movie. And then it sounds even less cool when I say I was an extra in a Lifetime movie. So it's not actually that cool at all, but I guess fun fact about me.
Well, you got to tell us the name of the movie.
It's called Speak. It's like a book that high schoolers read way back when, and they turned it into a Lifetime movie. They filmed it in Columbus like years ago, and my mom's like, "Hey, why don't we go over and see?" And I was in with what was it, Kristen Stewart. So I say before Team Edward and Team Jacob, there was Team Jimmy.
So I have to say this, that book is written by a woman named Laurie Halse Anderson.
Yes, it is.
And I've met her and she's wonderful. And I developed an immediate crush on her, even though my wife was in the room. And my wife knows that, so that's okay. She's a wonderful person. Thanks, Dr. Schooley. Jessica?
Yes, I am Jessica Johnson. I graduated in May of 2017 from Sinclair Community College, where I'm also employed as a faculty member in the hygiene clinic. So I've obviously been practicing for just a little over 3 years, and I started my career here in Aspen in September of 2017, just shortly after I graduated. Slight fun fact about me, I don't know, fun, but I guess basically like, who am I? Mom and wife, so good work balance that I try to find. I've been married for 20 years, and I have a soon-to-be 19-year-old and a 17-year-old.
Thank you, Jessica. Kristen?
Hi, everybody. I'm Kristen Sokop. I have been practicing in the dental field for about 17 years now, going on my 18th year. I graduated from Sinclair in 2010. I was a dental assistant for 7 years, and this is my 11th year as a hygienist. I love it. I've been with Aspen since December. I left a practice that I worked at for 10 years and wanted to go corporate for many reasons, and I adore it. Fun fact for me, same as Jess, I'm a working mom. I have 2 kids, they're 7 and 4, and a German Shepherd who's 2. My hands are full.
Thanks, everybody. All right, so just as a reminder, we call these sessions Ask Me Anything, and it really means that there's no question that's off limits. It's a great way for us to connect you folks who are attending with our clinicians. So I'm going to start with one that I think is a good way to get us started off. So somebody's asked, why would I want to leave my private practice after 10 years for a DSL? Kristen?
So I left a practice after 10 years with a doctor who was like family to me. They watched me graduate, they watched me get married and have kids. That doctor is now retiring and leaving his practice, and I was heartbroken when I had to leave that. I knew immediately I wanted to go corporate because I wanted the security of a corporation and I wanted good health insurance and benefits. When you have that security of a corporation behind you, it makes you feel more secure as a clinician. I've been through that. It was the hardest thing I ever did. It broke me, but going to a corporation was the best thing for me. And it gave me a lot of security.
Great, thank you. Jessica and Dr. Schooley, I think both of you started your careers with Aspen. And so I'll rephrase the question. How come you decided to go with a DSO rather than a private practice? Jessica?
Same as what Kristen said, benefits is really important for my family. Like I said, I have 2 teenagers. They are both very athletic. So lots of sports injuries are happening in our household. Probably 4 MRIs this past year alone. But also just seeing the structure. So I subbed in private practice, and sometimes I felt a little lost because there wasn't a good perio program. There just wasn't good systems in place, no brochures. How do you explain to a patient they've got periodontal disease? We have all the tools at your fingertips and more that you couldn't even dream of having. So it makes it very easy to communicate with your patients, to let them know what they need, and then it's that structure. I thrive on structure, and that, I mean, it's biggest thing, and this is what I tell most of the students when I talk to them at Sinclair. Dentistry is very gray, but Aspen tries to make it as black and white as possible. And that's just easy to abide by. You always know the right answer.
I'll correct you a little bit. So when I graduated last year, I briefly moved to the DC area and worked for another DSO, just because it happened to be one of the only areas where there wasn't an Aspen practice within kind of the distance I wanted to be. I like this one a lot more, but I guess the reason for Aspen versus kind of private practice, I always thought I was going to go right into private practice. My dad's actually a dentist, but my brother actually joined Aspen last year. I joined this year, and kind of the things that we've both seen is that you see so many different types of patients, and you get so many different opportunities that you really don't get when you're coming out of school, not just as a dentist, but even as a hygienist. And I think the one thing, and this is kind of a hygiene related thing, one nice thing about Aspen is that a lot of patients that wouldn't be able to get some types of treatment, whether it's scaling and root planing, gingival scaling, things like that, because of the costs, are able to get it here because of the financing, because of the different options. So it really makes you feel good when you're able to get people the type of care that they need. Versus sometimes in private practice, you're not really able to because of financial or other reasons. So we really, saying yes is a big important thing here. So we really want to be able to do that for our patients. And I've been lucky enough to see that in the 6 months that I've been here so far.
Great, thank you. Were you nervous or concerned about signing a contract with the DSO? And just before I allow our panelists to answer, I'm going to clarify something because I'm a stickler for language. Aspen Dental does not have contracts. We have what are called agreements, and it's an important distinction. I'm not just playing with the words here. Arguably, the most significant thing about it is there's no restrictive covenant, and you're not tied in for a set period of time. And that's a major distinction between Aspen and some other DSOs, that there's no truly binding elements of a contract in an agreement. So does anybody have anything they want to add on that about signing with the DSO?
I wasn't too nervous. I think this is whether it's being a dentist, hygienist, or any kind of job in general, who you work for is a big thing. So my owner, Dr. Reddy here in Ohio, he owns a bunch of the Aspen offices, and I knew him very well before I signed any agreement. And when you feel comfortable for the person you're working for, I think that makes a big difference. So I knew, like, if I ever need anything, I can call him, I can call our regional team, I can talk to our director, regional manager, office manager. We have a lot of support that can kind of help me out. So I didn't really have any concerns because I knew I had basically a team to kind of back me up on different fronts.
Great, thank you. What resources and training programs were provided to you, those of you that came right out of dental school or hygiene school? So how was that transition and what was provided for you? Jessica, you want to take this one?
Sure. So one of the great things about being hired on here, especially if you're a new grad, is you're going to get your first 2 weeks, you train in another office. Not necessarily the one that you're going to be working in. You're going to be training with hygienists who will be there with you every step of the way. For example, we are a training office here, and you will do your first prophy, your first scaling and root planning, hopefully your first gingivitis treatment, and even a potential Zoom whitening. We try to make sure that we build those 2 weeks you're here with us, that you get to do all of those with us. It's very hands-on. You get to learn the computer system because we do work on a different platform, very easy to understand and learn. And then you get that opportunity where you can ask us any of those questions. You're not just thrown to the wolves, sink or swim, figure out how this works. Because our offices are busy and they run very well, and you need to know kind of what you're doing to be able to be successful and do what needs to be done.
Thanks. Dr. Schooley, what about you? What are your thoughts on that?
So when I started, I went to a few different offices to see because every different, whether it's private practice, DSO, every different office runs differently. So when I first got here, I shadowed kind of in a few different offices, did some procedures, and then I started up, obviously because of COVID, and I'm sure we're going to get into COVID here more during this discussion, but some of the training courses that I would have normally gone to have kind of been postponed. I know in Chicago they send people to, so they have courses there. They have a lot of online stuff. So right now I've been doing a bunch of modules and things like that, but I know once things are up and running, full swing again, there'll be some more in-person kind of trainings and CE that I'll be involved in. But I mean, that's another big benefit of why I wanted to join Aspen, is because of the amount of CE and kind of training they have available to us here.
Great, thank you. How much time do you get per patient, specifically with regards to hygiene procedures? Kristen?
We get 1 hour appointments mainly for our regular prophies, but for scaling and root planing, it really depends if you're doing full mouth or half mouth. I've taken an hour and a half to 2 hours for a full mouth, or an hour and a half. It just depends on the patient as well. You've got to think about patient comfort. You know, everybody deals with anxiety different being in the dental office. We have that flexibility to control our schedule at Aspen. I am in control of my own schedule. I'm in control of my own patient care. Nobody pressures me. I can have as much time or as little time as I want.
Thank you. Jessica, do you want to add something?
Yeah, it reminds me of just a little heartwarming story as far as those times. You know, we really get to pick based on the patient needs. So we had a gentleman come on a Monday. He needed clearance for a hip replacement. Came on a Monday. He needed scaling and root planning. He needed to do financing. So we worked with him through the week. He came and saw me on a Friday. We were able to do full mouth. He was getting his surgery that following Monday. I explained to the patient, hey, I've got to check other new patients. I'm going to be coming in and out of the room some, but if you're patient, I will get you done. And I spent 4 hours with him because it was a difficult cleaning, and I kept checking on him all the way, but that's just what we did, and we got it done, and he got his hip replaced. He's doing great. So it's really what that patient needs and what you need as a clinician.
Thank you. Dr. Schooley, what about on the dental side? Do you have your freedom to choose how long each appointment is, or each procedure is, or do you have to follow a schedule dictated outside of the office?
So when I first got to my office, they asked me, like, how long do you want for each different type of procedure? And obviously every patient's different. So sometimes I'll see a patient, I'll be like, I need a little longer for this set of extractions, or these are going to be easy, make this shorter. So it kind of varies based on the patient. As far as new patients go, we kind of have them in 1 hour blocks. And I actually like to spend a little more time in my new patient exams, because I feel when I explain the treatment to patients and my hygienist explains everything, Jeannie, they accept more and they're more understanding, so they kind of are aware of what's going on and the problems that could arise or the benefits. So I like to spend a little bit more time in my new patient exams. And as far as like when I pop in the hygiene room to kind of do periodic exams, it really depends. If they have nothing going on, it's sometimes really quick. And sometimes if they need a little bit more explanation and work, it takes a little longer. So really, I mean, my schedule is kind of based on what works for me. Like perfect example is today. Normally I work until 6 or so on what day is today? I don't even know with COVID. It's Thursday. Normally I work till 6, but I was like, hey, I need to be on a Zoom call, so I left early today. So they're really good about my schedule and working around things when I need it.
Great, thank you. And when you say they're really good about your schedule, are you referring to the practice owner?
So I'm talking about basically my team, and specifically directly my office manager I work with my schedule, but they kind of just check in with our regional manager, director, senior director about things like that. Like that's what I'm talking about. All of us are basically texting throughout the week about various things that happen in the office. So any question I get, any supply order that I need, any patient question that comes up, I get an answer from someone within minutes basically about anything or a call back. So really there's a lot of communication between a lot of people, and that's, I forgot to, I keep thinking of things later. That's something I forgot to mention before. There's a lot of what makes Aspen so successful. There's so many offices. They've seen what works, what doesn't work, just from the business side, from the communication side. So they have people that are experts in all these various areas. So if I need something, I can get it from someone, because I'm definitely not an expert on everything. Maybe Ohio State football, but that's it.
Very good. This is for Jessica and Kristen. Do Aspen dental hygienists have flexible scheduling, or are you always working sort of 8 to 5?
Jess, do you want me to do it?
You can, that's fine.
Okay. Every office has different hours. I know some hygienists take, they only work 4 days. I work 5 days a week. I know Jess works 4 days a week. We were really given the option for a work-life balance. I don't know how many times my boss said that to me in my interview. I want you to have a work-life balance, because she wants me to be able to enjoy my family, but be successful at work as well. So I work 5 days a week in my office. I am the only hygienist in my office. Jessica has the opportunity to have another hygienist there with her, so she works 4 days a week. It just depends on what works for you and what the need is for the office you're going to, I would believe. Jess, do you agree with that?
I do, yeah. We have another hygienist in our market, and she needs to be the one that takes her kids to school on certain days, so she can't start until 8:30. And then like your hours are different than my hours. We work a 7 to 5 now, which is wonderful, and I'm thankful for, because nothing's happening in the morning in my household for me. But in the evening, I do like to be home, cook dinner, and have time with the family.
Great, thank you. So folks, there's a lot of questions coming in, which is great. I'm trying to sort of combine questions into categories so that we can focus on topics. What I'm basically saying is there's a reason I haven't asked any PPE or COVID questions yet. We'll certainly get to that. It does seem to be the hot topic.
Bring down the mood, Joel. Come on.
I'm sorry. we got to give the people what they want, but
so ask if we do that.
There's a question here that says, tell us about the recruiting and interview process. Did you meet someone at Aspen, and was there anything different about the recruiting process than there was with other DSOs?
I spent 2 hours in my interview with Jessica at Beaver Creek. She was just so warm and welcoming. I just love her to pieces. They were just so open to me and welcoming to me. And I think I received maybe 2 or 3 phone calls through recruiting. I talked to my boss, and then I went in for an interview. It was pretty simple and easy. Jess, would you agree?
Yeah, basically had a phone conversation with our hygiene territory manager, and came in for an interview, and they wanted to hire him. They extended a job offer, and it was too good to turn away. So, yeah.
Great. What about you, Dr. Schooley? Did you deal with a recruiter?
So I had a recruiter, Jeff, actually at Ohio State. Great guy. We had a good time at tailgates at the SIO house and things like that. But my actual official recruitment was probably a little different, just because my brother was already working for Aspen. I met most of the people that I guess were recruiting me at a holiday party at my owner's house. So I guess the interview went well, because.
And for our audience at home, the gentleman that Jim mentioned, Jeff, is a member of my team. So shout out for the academic team. Thank you.
Yes, I met Jeff.
There's a question here that's just come in. Seems like it might be one of the most important questions of the day. Dr. Schooley, do the dentist statues behind you have names?
I told Joel, so when I moved back from Virginia, I was going to get a place. All this kind of stuff in the world happened. So I'm actually at my parents' right now, and I'm trying to find a room where the dog isn't barking. Found the computer room. There was nothing in the background. So I swapped out some random statues with some dentists back there, just for, I don't know. I just wanted to look like we're doing something dental related here in this house. They don't have names. I think my dad got them from a patient way back when. So no names. You can name them if you want, though. If someone has a good suggestion, put it in the chat box.
All right, so somebody, here's a question that just came in. So, and I'm going to combine it with another one. What is a typical day really like, and how many patients do you see? Kristen, let's start with you.
I see 8 to 10 new patients. So I do 8 to 10 perio charts per day. And then I probably see, I want to say 10 to 12 hygiene patients. It really just depends on the day and what they are. I have to learn to work appropriately and quickly and efficiently. And I have a pretty easy day. I work great with my doctor. We become great teammates, and that's what my day looks like usually.
Great. Jessica, what does a regular day look like for you? And what's a day really like, and how many patients do you see?
Yeah, so basically kind of along the same lines as Kristen. Fortunately, we are a dual hygiene office, so there are 2 of us here. I am the associate, so I will see more of the scaling and root planning, the gingivitis therapy, and then our other hygienist, our lead hygienist, she will see most of the new patients, but we just also communicate very well because we are a busy office. So we book on the hour and we work 9 hours a day. And then as far as new patients, we can have, anywhere from 8 to 12 today, maybe more. But kind of to circle back to what I was saying in the very beginning about, like Kristen said, being efficient and working smart, we have the tools so you don't have to scramble to figure out, okay, I've got to tell this patient they've got scaling and root planning and they're not understanding you. You have a pamphlet that you can show them, and we have computer screens in every room. I don't think you can see the one behind you, but there's computer screens. You can pull up the x-rays and show the patient what you're looking at. Not all the offices, but some of them have the iTero, which we use for Invisalign, and we do intraoral scans. So you can show the patient what's going on inside their mouth that way as well. So you have all the tools right there at your fingertips, so you can just snap right through and show that patient what they need.
Thank you, Jessica. Dr. Schooley, what does a typical day look like for you?
So it varies. I actually just pulled up our metrics while you guys were talking. I think right now this month we're seeing between 7 and 8 new patients a day. Existing, I mean, it varies. Right now it says in the 20s, but when I actually said that number to my mom, when she goes, "You're seeing 20 patients a day during COVID, what's going on?" I have to explain to her that's not actually. So a lot of those patients is like a quick wax bite or an impression or something. So a lot of these people are only actually in the chair for 5-10 minutes at a time. So as far as production patients, I'll see maybe like anywhere from 4 to 6 procedures during the day, depending kind of what's going on. I'll do maybe 4 to 6 periodic checks and kind of just various things. So it really depends, but it's a really manageable schedule. It's busy in our office, but it's definitely manageable.
Great, thank you. What would you say is unique to your practice? What's the culture like? Jessica, I'm going to put you on the spot.
All right. So We actually have a really cool poster board in the back where we have pictures, and it says, your vibe attracts your tribe. So what that means is we just all try to stay positive and upbeat. Obviously, every day is not going to go perfect, but you've got to make the best of it and just rely on your team. And that's kind of the atmosphere we try to keep here. We want to make sure that our patients never know if there is literally a fire going on somewhere, because it's going to happen. That happens anywhere, regardless of where you're at. So we just try to work really well, communicate, and just be efficient in those means. And one of the things, like in your hiring process, I know, Kristen, you did the same. You get to go around and you get to meet the people, and you get to get that impression, you know, and see how you interact and what is that chemistry, and you'll get to see if there's a good fit for you or not.
Thanks, Jessica. Kristen, thoughts on the culture? What makes
Teamwork.
your practice unique?
Teamwork makes the dream work.
Yes.
My doctor knows that when I go in to do that medical history on that new patient, that's the start of his exam, and he can be efficient throughout then. He and I pass each other in the hallway. He knows that I'm doing my thing. He's doing his thing. And together we're creating a good environment for our patient. So that's all about what it is. Teamwork makes the dream work. We say that to each other, I don't know how many times a day.
Thank you. Doc, what makes your practice unique?
I don't know if I'd say it's unique. I just think we like to kind of have a laid back, kind of fun atmosphere. So obviously we get work done, but throughout the day, we're kind of passing by, making jokes, things like that. We'll go to lunch together as a team sometimes. So we just like to kind of keep it laid back. And so, I mean, you're at work, 8, 9 hours a day sometimes. You want to be able to enjoy yourself. So we kind of like to just make it fun for everyone while we're at work. So I don't know if it's unique. It's just we like to keep it laid back there.
Great. Thank you. Okay, so here, bring on the PPE questions. The very first question, with regards to COVID, do you feel safe at work?
Yes.
Yes.
Okay,
So-
excellent.
Well, I actually made a joke to my regional manager, Jamie, earlier today. I was like, they've sent me 3 different types of N95 masks within the last few weeks. I literally have boxes on. At first, I was like, I'm not going to have enough boxes. I have way too many boxes of N95s. Now we have regular level 3 masks, other masks for the front office staff. I mean, masks on masks. We got face shields. We have temperatures for, like, we so many precautions, because, I mean, it's very good. We want to definitely be safe, and questionnaires. So I definitely feel like anything we can do to make sure that we're running a safe environment, we are doing right now.
Is there a concern? It doesn't sound like there is with Dr. Schooley, but is there a concern about a PPE shortage?
No, I don't have one.
No, same here. I wonder if, because we are corporate, we have a good relationship with Henry Schein, and we have never had an issue. We have what we need.
Thank you. And I'll add just a little bit of color here because I have some insights into this. We're Henry Schein's second biggest customer after the US government, and we have some fantastic arrangements with them. And every practice across the network has at least 30 days of PPE on hand. It was certainly tighter during the height of the crisis, but our dedicated procurement team did an incredible job of making sure the practices that remained open throughout COVID were well stocked with PPE. So thank you. That's an excellent question. In what ways were you supported? Actually, I'm going to add in my own question here. Did all of your practices remain open throughout COVID?
Mine did not.
No, we closed down for about 6 or 7 weeks.
We were shut down for probably about, 5 or 6 weeks as well.
Great. Dr. Schooley, did you practice teledentistry?
I actually had the opportunity. They ended up not needing me because they had enough doctors, I guess, in our area to do it. But I know it was available to our patients. I didn't do teledentistry, but I did answer. I kind of took calls for patients that needed either antibiotics or things during that time as well.
Great, thank you. So can you talk a little bit about what Aspen has done with regards to ensuring safety for both staff and patients? Who wants it? Kristen?
Sure. So our patients stay out in the car until we're ready for them. There's nobody waiting out in the waiting room. I go out, I take a temperature. Have you traveled in the last 14 days? Have you been to a hot spot in the last 14 days? Have you had a positive COVID test? You have been with anybody with a positive COVID test? We then come back, everybody's got masks on. I've got an N95, I've got a level 3, I've got a shield, I've got a disposable coat over my lab coat. I wear a hat, as Joel saw me the other day in the office. You can only see my eyes. My patient is brought back. They do a pre-procedural rinse. I have high volume suctions running. I have, every precaution that I can make for my patient, I'm doing it. But I'm also practicing those universal precautions that we learned in school. So I think that we do the best to protect our patients and ourselves.
Jessica? Yeah.
In addition, in our office, same procedures. We also have a timer that is set for 60 minutes up at the front office where everyone can hear it. It goes off, and that's your cue. It's time to go wipe everything down. Patient bathroom, lobby, chairs, because there is the occasion where you have someone that doesn't have a cell phone. And if they're elder, if they don't have air conditioning, we will let them stay in our lobby and then just work quickly to try to get them back into a room. And then, cleaning procedures, we have all the cleaning supplies that we need, and we just get what needs to be done.
Doc, anything to add?
I'd say ditto. We've been lucky. We haven't had any of those, those viral videos of the patients that really don't like the PPE procedures in various offices. All the patients are real happy with what we're doing. They kind of understand. Sometimes because we work past, 5, when Mike DeWine has his wine with DeWine, we have patients just while they're in their chair and they're getting their updates while they're with us. So everyone's good. I mean, ditto what everyone said.
Are you trying to minimize aerosols?
So on my side, I have to use aerosols basically for different surgical procedures, but if ever I don't have to use them, I try not to use them. So basically whenever it's necessary for different types of, whether it's fillings or surgical extractions or things, but other than that, not really using any aerosols whenever possible.
Thank you.
Yeah, and they've provided, and I don't know if you've gotten it in your office, Kristen, here in our office, we have, it's called the Dry Shield, I believe. So it's an apparatus that you can use when using your ultrasonic scaler, when you're doing a scaling and rate planning or perio maintenance therapy, and it helps with that. Or sometimes I will hold the high vacuum evacuation, and I feel very comfortable with it. Before COVID, I would just let the patient hold the suction and their face would constantly get wet. Now that I'm doing it, their face never gets wet. So I know that we're doing a good job and we're capturing as much aerosol as possible.
The thing I've noticed is actually a side benefit is I personally have gotten a lot better about my own PPE during this kind of whole situation. Because I remember before all this, if ever I needed to pop in for an exam, sometimes I wouldn't have goggles on, or sometimes I just pop in and just look at something. But right now I make sure goggles, gloves, masks, and it's all like stuff in dental and hygiene school. They teach you that you need all these things, but really until you're kind of faced with a situation like this, it really hammered home like, hey, we need to do these things. So it's been a side benefit. I've gotten really good about using everything now.
Great. Thank you. Are you limited to specific instruments? And I'm sorry, this is moving a little bit away from COVID, and we'll return to that in a moment. But does Aspen limit you to the instruments that you use, or can you pick and choose the or particular suppliers, or are you free to use any instruments that you'd like?
We order from Henry Schein and we get what we want. We do what we need to do to provide that care for our patient.
Great.
Yeah,
Thank you.
In our office, we have the American Eagle Forever Sharp instruments, and they're amazing. And we basically, it's your business. You're given a budget, and you get what you need based on what you can afford on your budget. So it's just like running your own little business.
Thank you, Jessica. Again, it's an Ask Me Anything, so we accept any question that's posed. Were you compensated when your offices were closed?
So they placed us on furlough. And what that means is we got to keep our benefits. That was the huge issue that they tried to figure out. So we were able to apply for unemployment and obtain the extra $600 a week once that started.
Great, thank you. Anybody want to add something? Okay.
No, I'm furloughed.
Pardon me?
I was furloughed as well, so same kind of situation.
Great, thank you. I'm looking to see, there was one that just caught my eye a moment ago. Dr. Schooley, does Aspen offer opportunity for practice ownership? So could you talk a little bit about that?
Yes, it does. And that's one of the other kind of benefits. So normally when you first get hired, you start out as associate. I actually was lucky just because of my situation. I knew Dr. Reddy. I knew my brother was here. I actually was hired as an MCD, which is a managing clinical director, which is kind of the next step. The next step after that is ownership. So I'll be looking at that here shortly, kind of once I get a little bit more experience under me, but they definitely do have opportunities for ownership, whether it's in one office. I know some people actually own various offices. So it's kind of what your individual goals are for ownership or that kind of situation. But definitely there are ownership, and even above that, you can become part of the Aspen management team. I don't know, Joel probably knows more about that, but there's even other opportunities as well. So there's various levels of involvement that you can get in with Aspen Dental.
That is an excellent question. It actually harks back to a question that somebody just posted. Are there opportunities outside of chairside hygiene, and what does that path look like? So Jessica or Kristen, do either of you want to speak to this? I certainly can, but I think they prefer to hear from you.
Jess, you want to take this one?
Sure. So there are opportunities outside of that, and our business models are always evolving anyway. So there's always different paths that you can take, but certainly there are coaching and training opportunities. So our structure is a little bit different here. Like I don't personally report to anyone in my where I work. I report to a territory hygiene support manager, and those are all across the nation. So there's definitely opportunity for growth.
Great, thank you. I'll elaborate just a little bit. There's a story that I like to tell. There's a member of my team, her name is Holly Farbo, and she had worked in private practice for 19 years as a hygienist. And I don't want to put words in her mouth, but I've had this conversation with her so many times that I think I can speak to it. She had requested additional responsibilities or other ways that she could use her talents, and those opportunities just never manifested. She started working at an Aspen Dental practice, and within a year, after vocalizing that she had other talents and she wanted to share them, she wound up joining my team, and now she works in the recruiting process, meeting young hygienists and hygienists that are still in school and talking with them about the options available at Aspen Dental. So that's just one little example of somebody that was interested in going beyond chairside, and now she's on my team and she's making a fantastic impact on my team. Similarly, there are what we call field positions. Jessica referred to before to her territory manager of hygiene support. These are field positions that oversee hygiene practices in designated areas. And there are a lot of roles like that that are typically growth opportunities for practicing hygienists to move into if folks are interested in moving away from that side. So thank you for those questions. Okay, so on that note, there's somebody who posted like 10 questions in one here. One of them was, how do you grow your career in the organization? So I think we've answered that. So there's a question here about, in this person's whole little bundle here, how does Aspen provide, or what does Aspen provide in terms of CE for hygienists? So Jessica and Kristen, can you speak a little bit to CE opportunities that you've had since you've joined Aspen?
We have a lot of CE opportunities on what we call the bridge. Everything you can imagine is on there. I'm currently tomorrow going to take a CE about Invisalign. Something that's the only realm of dental that I've never experienced is ortho. And our office is going to start to offer Invisalign, and we get to, as an office together tomorrow, take some education about it. So that's really cool for us.
Yes, I renewed my license this past December, and when I submitted my 24 CEs, not one of them I sought out. They were provided to me. We have annual, sometimes biannual hygiene meetings where you'll get together with, your region, and they will bring in guest speakers, and they'll go over like the new periodontal classification. We've been doing that quite a bit, and they will continue to train you on that. You earn CEs through that. Invisalign, we learned last year. We went to Pittsburgh and were trained, earned CEs through that. I'm trying to think of I did not have to look for one of my 24 that I earned. They were all provided and just planned to attend.
Thank you. I'm going to use this opportunity to plug a project that I've been leading. We have made our CE library available to the public. So if you've got a pen or if you're at a computer, aspendentalce.com, 100% free 4-credit CE opportunities available literally to anybody in the industry for at least a year, ending next March. And we've given away something like 5,000 credits through there. So feel free to go ahead and check that out. There was a comment before about the intraoral scanners. What other technologies are being in use at the practices? Dr. Schooley, do you want to speak to that?
Trying to think. I mean, we use the intraoral scanners for not just Invisalign, but also we now are actually scanning all of our crowns, our removable pieces, just because, especially now in the current situation, our labs that we were working with, sometimes we're not getting our crowns back as quickly as we liked. It was still not bad, like a couple weeks, but now we'll scan everything and we'll get back our crowns sometimes in like 6 or 7 days, which is great because, a lot of people, whenever they're in temporaries, they hate those. So we use a lot of that. Obviously, just kind of like we'll take a lot of pictures. I know now we actually just got these new retractors that you don't even have to hold anymore. The patient kind of does it themselves for great pictures. So sometimes we can kind of show those to patients to kind of see what different types of treatments and kind of progressions look like. So just various things to kind of make it easier for the patient to see where their treatment is heading, kind of the final product. Because when you're at the beginning, they're kind of like, oh, what is this? What's that? But when you can kind of show them where they're headed, it makes it a lot easier for them.
Dr. Schooley, are you using CBCT scanners, and is there a plan to bring those into the practice?
We currently do not have one in our office. We've actually been talking about possibly maybe getting one in ours because we actually are one of the busiest offices in Ohio. But that's currently not in our office. For any of our CBCTs, we just refer to a nearby one, and then they kind of return on the oral surgery day with their CBCT done. But I know that is in the works, especially with, there's a program, the Implant Continuum, kind of up and running with Aspen, where all the doctors were getting a lot of implant training. So within the next calendar year, I think there's going to be a lot of developments with implants and CBCT happening. Joel, I couldn't hear you.
I'm sorry about that. Jessica and Kristen, anything to add regarding technology?
Yeah, I have 2 things. Our patients now do paperless check-in, so they don't have to fill out a medical history on paper form now. We have iPads that I don't even have my patient hold it until it's time to sign. I sit there and hold it for them and say, we're going to scroll through these. Please let me know when to check yes, when to check no. What are your meds? Do you have a list? All on an iPad, so there's no more paper. Also, as Jessica touched on earlier, we have a computer screen that sits in front of our patient. So when I'm done with my perio chart, I flip it back on it and I make sure that patient understands everything in red, these numbers and above, you're, in a disease state as far as needing scaling and root planing. And I also can take their x-rays and show them this is where your bone should be, take that radiographic measurement so they can see exactly where they are, and they get a better understanding because it's visual. Everybody always understands when things are, visual instead of just telling them.
Thank you. Jessica, anything to add?
No, I think they touched on everything.
Great. So again, I've got some insights. I work for Aspen Dental Management, which is the sort of, which very funny, which is the dental support organization that supports the clinicians. So I'm privy to some fun facts. A couple of years ago, we launched the Invisalign project, where one of those goals was to get those intraoral scanners into every practice, and we're pretty much there in up probably the high 90 percentages of the 820 something practices across the network. And 2020 was intended to be the year to roll out the CBCT scanners like Dr. Schooley mentioned. And of course, COVID happened and slowed everything down. But there is a plan in place to get CBCT scanners into every Aspen dental practice within about 18 months, which is extremely exciting. Of course, I don't know what it looks like or what it does. I mean, I know a little bit about what it does, but I understand when we tell that to clinicians, they get very excited.
I was told by doing this Zoom thing, I was getting a CBCT in the office. Is that correct, Joel?
Yours is actually arriving tonight. Just keep waiting outside the practice. It'll show up.
Perfect.
Great. So it's 7:45 on my clock. I want to make sure that we're respectful of everybody's time, so we'll do about 15 more minutes. Has the scheduling changed, and how has the scheduling changed sort of before and after COVID?
So as far as our new patients have gone, before we were running more of a 45-minute kind of schedule. Now we've increased it to an hour. And honestly, just manually, we put in kind of breaks that we want, and I space out my procedures just a little bit more, just to give myself and assistants time to kind of clean the operatories extra between each patient. We're just making sure that there's not too many people in the back office at any given time. Like Kristen already mentioned, patients wait in the car, just kind of spacing things out as much as we can just to kind of keep it safe. And obviously we're not becoming lackadaisical or anything, but over time, when we're seeing how like people's level of comfort, we can pick things up a little bit, but it really we've kind of kept it at a very much slower pace than we're used to, just because we wanted to be extra cautious during this time.
Thank you. Jessica or Kristen?
I say do what Doc said for me.
Yeah, and basically, like as far as hygiene side goes, one of the big changes, we offer that in-office whitening, and we usually would book that on the side because you're not with them as much because they're undergoing the treatment. That is now something that we don't really book on the side anymore. We just book them in our chair and then spend our time when we're not with them seeing new patients, things like that, just to make sure that we're keeping all of our patients safe and not going in between rooms too much.
Great, thank you. So this question just came in. Is oral surgery performed in your practices? That's the question.
Yeah, we have a oral surgeon, Dr. Patel, that comes in anywhere from 2 to 3 times a month. So he'll basically run a column himself. Actually, he's very good. He'll run 2 columns by himself, but he'll have a couple rooms designated to him throughout the day. He'll perform those procedures. Patients love that because that's the first question I get. Do I have to go somewhere else for this procedure? No, you just come here on that given day. You get sedated, you get not sedated, and they love it. So we have an oral surgeon that comes in a couple times a month.
Great. Okay, so here's one that just came in, and again, I like the AMA format. It's what we call warts and all. So this comment is, I think I like Aspen, but there's negative press and some reputation issues out there about DSOs. What do I tell my friends if I join Aspen?
I can answer that one because literally coming from a situation where my dad's a dentist. My grandfather was a dentist. I mean, growing up, you hear a lot of negative talk about DSOs, not really Aspen, but just DSOs in general. The thing I say is it really just comes down to, like I said earlier, who you're working for, kind of the environment. Before you join any practice, you want to see where you're going to working. If you like the environment, if you like the people there, I mean, DSO is just like any other private practice. It's not, no one's getting any different type of treatment, any different level of care. It's just the environment you're around. And if you feel comfortable in that environment, you can do great things. I love where I'm at right now. I wouldn't imagine any other situation, but it really depends on any given situation. And what I've noticed is, at least in the offices in our POP, in our region, it's kind of the same way. So if they're run well, which Aspen practices usually are, it's a great situation.
Thank you. I'm going to make everybody answer this question, if that's all right. So, Jessica, what do you think about some of the reputation concerns of DSOs?
So I always lean on the side of, you've got to read reviews, and you've got to read into what is that patient saying. Are they angry because I told them they had periodontal disease and now they hate Aspen because their dentist they've been going to for 30 years never told them they had perio, and then they come here and all of a sudden they have it? You've got to really read between the lines sometimes, because that happens a lot. And it's unfortunate that it happens, but we're corporate, we're a big name and an easy target. People aren't complaining about the little tiny dentist. Who are they going to scream to? You know, it's unfortunately, it's the nature, but what they're reading and what they're hearing about is happening everywhere, I promise you. Just because we're corporate dentistry, it is no different than those private practices out there.
Thank you, Jessica. Kristen?
Preach, Jess. There's negative everywhere. And you know what it does? It fuels my fire. It makes me go into those exams like, I am going to rock this patient's world today. I'm going to make them see what the teamwork in this office is all about. And that's, you know, when I see those negative reviews, I'm like, oh man, that's terrible. I hate it that you had a bad day at Aspen. But it makes me look at that next one and say, I'm going to do great. I'm going to knock it out of the park. So, I mean, there's just negative everywhere. Be the change you want to see.
And going off what Jessica was saying, like you learn this in stats in various classes, people that write reviews are usually people that have bad experiences. No one's going to go home and be like, Dr. Schooley blew up a balloon for my kid during the pediatric exam today. We loved him. No, they're going to be like, I had very little bone and my denture didn't fit. Well, it's not my problem you came in with hardly anything that a denture can hold on to, but the people that have bad experiences are the people that are going to write reviews. And because we see so many patients on a given day, you're bound to get people that aren't happy. But I can guarantee you there are way, way, way more people that are very happy with their treatment. They're just not saying anything because it went so well.
I have to agree with that. If I have a good experience at a restaurant, I'm almost certainly not going to do anything about it. But if I have a bad one, I might leave a bad review. I guess
just go back and eat more if you had a good experience.
Right. I vote with my money where I choose to spend. So, is there anything that disappointed you about your experience in Aspen? Somebody's posed that question and I appreciate it. You know, folks, I want you to know I don't prep our presenters. In fact, some of them haven't even met each other. This is a nice improvised conversation amongst us. So I appreciate the question. Is there anything that has turned out to be disappointing about your Aspen dental experience that you want to share with with our participants tonight? And it's okay if the answer is no, but it's also okay if the answer is yes.
Wouldn't even say disappointing. I just tell people whenever you join a practice, whether it's as a hygienist, as a dentist, it takes maybe like a month, 2 months to kind of get things running the way you like. So I like a certain type of schedule run in terms of this amount of time, this number of patients, this type of thing. I know my hygienist does as well. And until you kind of get everyone on the same page, there's going to be hiccups. But once everything's running smoothly, it's a lot better. So it's not even disappointment. It's just understanding, especially as we might have new hygienists or new dentists in the audience. When you first go into somewhere, you're going to take a little time to get acclimated, and that's okay. Just don't expect everything to be running smoothly right when you get there.
That's great. In fact, that leads really nicely into our next question. What advice would you give to young dentists and young hygienists that will be graduating after this year? Kristen, you want to start?
I'd say jump into it. It's the best field in the world. You get to help people. You get to see people smile when you're done with them. I had a 20-year-old patient who was a recovering drug addict come into me for their scaling and root planing after they were clean. And she literally broke down in my chair and said, "You changed my life. You finally got the rest of it out." And, I get to see patients like that, and that warms my heart. It makes what I do worthwhile. I take care of people. I say, just jump in. You're going to be okay. I've been doing it for almost 18 years. It's a lot of fun.
Thank you. Jessica?
Yeah, I would agree with that. And I know Dr. Schooley was talking about it earlier. The type of clientele that comes through our door. So if you have not been to the dentist in 40 years, you have no idea where to start, you have a toothache, where are you going to go? You're going to most likely go where what's popular, what you see, and that is the corporate dentistry. So we see a lot of people that come through our door that just need our help, no matter what it may be. So if you're looking to really change people's lives through dentistry, that's what at least that's what I do this for, is to help people. This definitely gives you that opportunity. If you're in a smaller practice somewhere, what's going to make the patient call that place? They're coming here. This is where they're coming. And they're just looking for help. And it takes a lot for these people to get through the door. So, yeah.
Thanks, Jessica. So Dr. Schooley, what advice would you give to an upcoming dental grad?
I always tell people that your first year of practice, and I'm sure it's probably the same as with our hygienists, you learn more in that first year than you do in your whole kind of training. Like I graduated dental school, things, but until you're there doing it every day, you don't see all the different circumstances, different situations. You learn so much. So I joke, when I was at my practice in Virginia, I was there for 6 months. I maybe did 12 extractions the whole time, just because I was doing a lot of crowns, of different things, but 12 extractions in 6 months. I did 16 extractions on my last patient of the day today. It was a full mouth kind of series. When I first got here in January, it would take me like an hour and a half to kind of do that. Now I did that whole procedure. It would take me an hour and a half to do one tooth. Now it takes me an hour and a half to do the whole kind of full mouth. So, and my assistant the other day goes, "You've gotten a lot better in the last few months." I was like, that's what happens when you're kind of out and practicing. So don't be afraid. Don't be too confident where you're doing things that you don't know how to do. But at first, it's going to take longer to do an extraction, a filling, an SRP, even a gingival scaling. It's going to take longer, but once you get better and more confident, your skills are going to grow, your confidence is going to grow, and your work's going to get even better. So don't come in thinking you're going to know everything. You're going to learn so much in that first year. And as long as you're open to getting advice from more seasoned dentists and hygienists and from CE, you're going to do great.
Thanks, Dr. Schooley. So I like to end with a question. It's a little bit corny, but I think it's fun. I'm going to ask each of you to summarize your experience at Aspen to date with a single word. One word.
That's tough.
Oh, I didn't say this was going to be easy, and now I'm going to pick someone. Jessica.
Oh, man. One word. That's hard.
All right, Jessica gets a pass.
Growth.
Growth.
I've grown so much.
Thank you. Kristen?
Fun. I have fun every day.
That's great. Dr. Schooley?
Yes, you can learn a lot of things. Yes, you can get patients the treatment they need. Yes, you can get them the financing they need. Yes, you can do a lot of things with Aspen Dental.
Well, that's wonderful. Thank you. I have chills from those responses. I've got exactly 7:59 on my clock. I can't think of a better note to end on. Thank you very, very much, Dr. Schooley, Jessica, Kristen. Thank you very much for your time tonight. And to our participants, thank you very much. Your questions were very helpful. They helped us guide the conversation, which is really what we're trying to do with these Ask Me Anythings. I hope we've been able to provide some information for you. You have my email address. If you have any more questions, please don't hesitate to reach out. And we will be posting the recording of this session shortly. So feel free to review it. And again, if you have any questions, please don't hesitate to reach out. Dr. Schooley, Jessica, and Kristen, thank you very much. Everybody have a nice night. Stay safe.
Thank you. Have a good one.
Bye-bye.